Then post-coital headache or primary headache associated with sexual activity. It is a headache triggered by sexual activity, often peaking at the time of the orgasm. They can mimic a very serious conditions like subarachnoid hemorrhage or reversible cerebral vasoconstriction syndrome, vasospasm in the cerebral artery. Red flags required urgent investigations, and urgent investigations, CT scan or MRI scan. First ever occurrence of such a headache. Yes, this patient had the first time to have this headache over the last few weeks. He didn't have it before. Sudden onset, yes, sudden onset. Reaching maximum intensity within 5 minutes, yes. He told you it comes just hitting me straight away. Hitting me straight away or coming in a sudden attack. If there is any associated symptoms like vomiting, visual change, neck stiffness, any neurological defect, or any confusion or altered level of consciousness, again, he fits the criteria for urgent referral to the hospital. Persistent or worsening headache. Okay, all of this is indications to send him to A&E. So what you need to do, guys, or first of all, how to explain. Thanks for explaining everything clearly. From what you have told me or from what you have shared with me, this headache comes on suddenly during sex and is quite intense. Because it is the first time you have experienced this, we do need to rule out some rare but serious causes, like a bleeding in your brain or changes in the blood vessels. It may turn out to be primary sexual headache, which is usually harmless and it can happen to otherwise healthy people. However, we cannot be sure without checking things properly. So, I really suggest attending emergency department. And please, guys, don't tell him I will refer you to acute medical unit. We don't send someone with suspected bleeding to acute medical unit. If you do that, that means you are not aware how the referral or which patient should go to which specialty. When I was on call, always when I was working in internal medicine, we never had any referral. We always reject anyone sending a referral suspected subarachnoid hemorrhage or suspected acute bleeding. He needs to go to A&E because if yes, this patient usually should go under neurosurgery. So send him to emergency department first for a brain scan to be safe. Once we have ruled out anything serious, we can manage it with simple treatments if needed. So what are the questions? More questions about headache itself. I think you asked most of them. Where is the headache? What can make it worse? What can make it better? You asked about aggravating symptoms, relieving symptoms. You asked about intensity. Also, you asked about many of the Socrates. Do you have any headache now? You asked about this already. Any neck stiffness, vomiting, visual change, any photophobia, fever, body rash, any weakness in any limbs, any abnormal sensation, all of that. How long is the headache last? You asked about this. Is it getting better after sex or no? And ask if this happened before or no. And if you did see any medical doctor for your headache or no. Any stress, any family history of similar condition, any family history of any kidney problem, especially polycystic kidney disease or bleeding in the brain. Any family history of any bleeding disorder. If you have time, you can ask about this. Did you try anything for your headache before? If patient has hypertension, please, very important, do you take your medication every day or no? Uncontrolled hypertension and very severe headache is a red flag. Could be internal or a brain hemorrhage. If he doesn't have hypertension, I can see from the notes you don't have any hypertension or high blood pressure. Is that correct? Don't forget, okay, definitely eyes and impact and social history. Management, addressing his eyes is not migraine because 1 to 3. It's not meningitis because 1 to 3. Don't tell him, no, it is not meningitis or not migraine without explaining or convincing him why it is not migraine. Give him the diagnosis. If you know, postcoital headache, or A&E, this is the best option or safest option. You are not referring, go to A&E, have the scan first. If it is coming back clear, don't worry, we do have many options to treat your headache. It is most likely a postcoital headache or the primary sexual headache. Okay, so send him to A&E and explain why. Once this has been ruled out, we have many options that we can discuss. There is medication options for acute treatment. There is prophylactic treatment, not only this, and also there are some options that you can do by yourself. Self-help measures. What are self-help measures? Maintaining good hydration, manage stress, regular exercise, losing weight if he is overweight. So it's important to ask about his weight as well, losing weight if he's overweight. And taking more passive role during sex to reduce the physical exertion during sexual intercourse. Taking a more passive role during sex to reduce physical exertion. Avoid triggers, make sure you have a good sleep. Okay, all of that can help to reduce the attacks. Follow up after A&E and to discuss further options. Leaflet from patient info about sexual headache. Safety net. Safety net if you get a sudden severe headache that is different from the usual, any visual change, any weakness, confusion, seek urgent medical advice or 999. What are the medication options, guys? For the acute attack, we can give him endomethadine, 25 to 75 milligram. He will take it 30 to 60 minutes before having sexual intercourse. Or triptans, he can take it like somatriptan, 30 to 60 minutes again before sex. This is the acute treatment options for postcoital headache. What are the prophylactic? Could be propranolol. Make sure he's not asthmatic. Could be tobramide. Hopefully she's not pregnant or planning to be pregnant. Could be diltiazem. Okay, so you have acute measures or acute treatment. You have prophylactic treatment. You have self-help measures. You need to discuss this, but you will explain best option now. Go to A&E, have the scan done. All right, I think
Hello there, this is Dr. Ashraf speaking from the practice. May I know who am I speaking to?
Yes, Dr. I'm James Patel.
Hi, good afternoon. Is this a good time to talk or would you like to go somewhere private?
Yeah, it's a good time.
Fantastic. And before you start, could you please confirm your age, full name, and first line of address for me, please?
Yes, at 35 years and 21 Flat US Street.
All right. And what would you prefer to be called?
James is fine.
Nice to meet you, James. How can I help?
So, say, Doctor, I don't know, like, from where I should start. It's a bit embarrassing, but however, I just get this, very intense headache, right after I just finished, sex, and it happened a few times now, and reached to a level that makes me a bit worried and scared too. So I don't know what's going on, to be honest.
Oh, I'm so sorry to hear about that. First of all, you don't need to be embarrassed. I'm all ears. I'm here to help. All right. And you mentioned you're worried. Can you tell me a bit more about it? What exactly are you worried about?
Yeah, it's it's this like sudden intense headache that happens immediately after I finish sex, and it just happened like 4 or 5 times now, and just in the back of my head, and it's always like very throbbing, and it's really hitting fast. So I'm not sure.
I'm so sorry about it. And can you mention like it's happened 4 or 5 times? Have I got it right?
Yes.
And how long have you been noticing it for? When was the first time you noticed?
About 4 weeks ago, 3 to 4 weeks ago.
3 to 4 weeks ago. And have you given any thoughts what it might be?
I don't know. I was thinking about migraine, but I've never had migraine before, and I wasn't sure if migraine happens like after any sort of sexual activity. But yeah.
I get it. And any particular reason you think it might be migraine, or like given a thought it came to your mind?
I think because of the intensity, like been hearing people suffer from migraine and complaining of like intense pain, severe pain in their head. So I thought,
Yes.
could it be migraine? I don't know.
Sorry. Let's see how I will talk and we'll see what can I do. Okay. And how's your life with it? Like you mentioned, like obviously after having intercourse, do you feel like how do you feel it's affecting your life?
It's really bad because when it happens, I can't do anything, and after it, I feel like dull aching, and uh, I feel like the pain is just hanging around for a bit after it settles. So that stopped me, sometimes from doing anything I need to complete on my day.
I see. Okay, so you cannot do anything, is that correct, to complete the day?
Yeah.
Oh, and what do you think might be helpful that I can do for you today?
And I was just wondering if any scan that can diagnose the problem or anything.
I get it. Definitely, that we can discuss. Before that, if I ask, it would be alright if I ask you a few questions just to make sure that number one, like if it's migraine or not, because if you're worried, and after that, I might ask you a few questions. Is that all right with
Yeah, that's all right.
you? First, a few questions about migraine because that's the first thing came in your mind. Did you ever had migraine in the past? I can see from the note that you have no medical history, like nothing significant. Is that the case now?
Yeah, yeah. As I said, I've never had it before. Yeah.
I get it. And do you feel like before you have the headache, can you think of any trigger or like do you see flashes of lights or maybe feeling sickly or anything like that?
Not really. No.
Fantastic. That's good to know. And you mentioned like obviously after the activity, like it starts. Can you grade the pain on a scale of 1 to 10 from me? 10 being absolute agony.
I would say 9 or 10.
9 or 10. Okay. Now I'm going to ask you a few questions because when someone is having headache, we also need to rule out sinister causes like any bleed or anything in the brain. Is that okay if I ask you a few more questions?
Yeah.
So you mentioned 9. Like, do you feel like it's the kind of worst headache of your life?
Yeah. I would say it's one of the worst pains I had.
Oh, sorry to hear about that. And do you feel like the pain gradually increases over time after it starts?
No, no, just hit very bad. It just happened suddenly and hit very fast.
Okay. And how long does it last for usually?
It's like between 30 to 40 minutes.
30 to 40 minutes. Okay. All right. And do you have to do anything for the pain to go away, or does it go away on its own?
I think it does go on its own because I tried to leave it. I tried
Okay.
paracetamol. I tried ibuprofen. Every time it takes like this like 30 40 minutes. And just
Okay.
you know after that I just have some dull aching pain around my head. That's it.
I get it. And do you find any weakness in one side of your body or anything just to rule out stroke or anything?
No, no.
Fantastic. Fantastic. And how's your appetite? Have you been eating and drinking okay with all of this going on?
Yeah, yeah,
All right. And in a few questions about your lifestyle, because sometimes they can be related. Is that all right with you?
yeah.
Do you smoke?
No, I don't.
I see. And what about drinking alcohol?
No, I don't drink.
I see. And do you feel like all of this is kind of it's normal, like it's making you worried? Do you feel yourself stressed or feeling low or anything like that?
uh I would say I'm a bit worried about this headache, but generally no, I'm not a worried person.
I get it. And in terms of medication, I can see you're not on any medication. Is that the case?
Yes.
Any non-prescription medication?
No.
Any drugs?
No.
Fantastic. And how's your sleep usually?
It's pretty good.
Okay. All right. So basically, you said you had this and you had this 4 to 5 times. It lasts usually 30 to 40 minutes, and it stays the same, and it goes on its own. Is that correct? And you're wondering if you can have any scan. Have I got it right so far?
Yes, that's right.
Okay. All right. And last question: are you having the headache right now?
Not really.
All right, fantastic. Thank you so much for letting me know. So, uh, you are right. Like when you mentioned like about migraine, it sounds like it doesn't sound like really migraine, which is a good news. All right.
Okay.
And however, you mentioned about having a scan. So basically, that yeah, you're right. Like that's something we can consider. However, about the pain, like the kind of the pain you're explaining, like you are having it after having the intercourse. So, like, remind me, like, are you like do you use any medication, like in terms of like to help you with the intercourse?
No, no.
Okay, all right. So how about maybe if you come into the practice today, do you think that would be an option so that we can have a face-to-face chat and maybe take your blood pressure, and like even though on record there is nothing, but you can check your blood pressure and see how things are, and also do some examination to check how your nerves are, and we can talk about further steps, including scan if necessary. How do you feel about that?
Yeah. But I think today might be a bit challenging because I'm at work till 7 o'clock. So, but I can come tomorrow at any time, because I can let my boss know and then I can come.
Fantastic. That would be really nice. But then I will see you tomorrow, and we will do the things as you mentioned, because we need to rule out other causes of headache like blood pressure or anything. And just to make sure that if you feel like there's any more headache further coming overnight, then like I'd suggest not to wait till the surgery opens and maybe call 111. Is that okay with you?
Yeah. That's okay. But are you going to request for me the scan tomorrow, or what will happen with the scan?
I see. So basically, when we meet tomorrow, we'll talk and do some exams. And after that, we'll decide that if you need the scan now, or if we need to maybe address the situation in some other way, or maybe we can do an advice and guidance to neurology to see what might be the reason, and if they're happy to do the scan. And then we can decide. How do you feel about that?
Yeah. That's fine. Yeah.
Fantastic, fantastic. It was really nice to talk to you. And do you have any other queries or anything else I can help you with?
Um, I'd say that like while having this pain, like is it safe to continue having sex, or should I stop till we do the investigation and everything, or I
Yeah, yeah, okay. Yeah, thank you for bringing this up. Yeah, I would suggest how about we talk tomorrow, and maybe till we do further look further into it. We How about like what's the thought of maybe like avoiding not only sex, any kind of work that kind of triggers the headache. How do you feel about that?
yeah, but nothing triggered it off. Like I've been going to the gym 4 times a week. I've been exercising, but never happened during exercise.
That's fantastic. That's really good to know. So in that case, at least just the possible trigger seems to be the intercourse, like maybe uh, avoid it till we meet and have a talk about that. How do you feel?
Yeah.
Right? And so is there like what have we discussed so far? Is there anything you would like me to repeat, or you'd like me to tell you again or anything like that?
No, because I think if we're going to meet tomorrow, yeah, we can discuss about medication and anything that can be taken before having sex to prevent this headaches from coming on. So yeah,
Fantastic. It was really lovely to talk to you, and I hope your work goes well and have a nice rest of the day. All right.
thank you.
Thank you. Cheers. Bye.
Bye.
Well done. I like your IPS. Your IPS is good. Your tone was okay. You're smiling most of the station, which is really good. You started with, I am sorry to hear about that. Although there are many things that instead of I'm sorry, because as Mo said, it sounds robotic. There are many things, guys, and even in the IPS workshop, we give you alternative ways to show empathy, to reflect on the cues, all of that. Okay, in relating to others. Otherwise, most of the people say, I'm sorry. If you say something different, it will get you higher marks. And I will tell you guys, both of you guys are going, you and Soder, you are asking guys about impact in the direct way. In the direct way, how is this affecting you or impacting you? Well, yes, you are ticking the box for asking about impact, but again, in the IPS course, we teach you guys how you can ask about impact in indirect way. If you have British people sitting in the exam, most of them, they will not ask how this affecting you or impacting you. Okay, they will ask in indirect way. For example, has this prevented you from doing whatever you used to do? How you managing with all of that? How you coping with this? Okay, instead of asking in an indirect way, there are many ways that you can ask in indirect way, even it will looks nicer. Okay, just because both of you ask it directly about impact. Has this stopped you from doing whatever you used to do? Has it stopped you from doing your usual daily routine? This is another way to ask about impact in indirect way. Okay. Again, it's a very simple phrase. Has it stopped you from doing whatever you used to do? Has it stopped you from going to your work, doing your daily routine, all of that? Okay. So Arif, you then told him when this is the first time it happened, and then you asked about thoughts. He told you migraine. Then you asked him why migraine. Then you asked him about impact. You asked him, has this affected your life? Then you asked about expectations. He told you scan. Then you asked, did you have migraine before? It was a repeat because he told you I didn't have migraine before. You asked him again, did you have migraine before? So that was a little bit of repeat. Then you asked about aura, like flashing of lights, blah, blah, blah. So you asked about aura for migraine. Then you told him on a scale from 1 to 10, he told you 9 or 10 out of 10. You asked, is it the worst headache in your life? He told you, yes, one of the worst. Then you asked, is the pain is building up gradually? Then you asked, how long does it last? He told you 30, 40 minutes. Any relieving factors? You asked about appetite. You asked about lifestyle, smoking, alcohol. And you asked about stress or low mood. So you asked about mood. Then you asked about any over-the-counter medication, sleep, or any drugs. All right, good. Then you started to summarize. Well, first of all, before we go to the management, you neglected important history taking here. Okay. Anyone coming with severe headache, you didn't ask about vomiting, visual change. Okay, you didn't ask about, for example, meningitis, any fever, any skin rash, any neck stiffness, any photophobia. You didn't ask about any of the red flags. You can even ask about weight loss or something like this. We said, guys, before, and you will find it today in the flashcard when we will present the flashcard. If someone coming with severe headache, middle age, could it be also underlying adult polycystic kidney disease with hypertension, especially if there is any perianeurysm or something like that? Worth asking any family history of any kidney problem or polycystic kidney, something like that. Okay, I can see you don't have any high blood pressure. Is that correct? Reflect on that, because if he's having hypertension with severe headache, it is a red flag. Okay, I know you told him come for blood pressure check, but again, try to reflect, try to rule out different things. You didn't rule out here difference. You only ruled out migraine, and that's it. You didn't rule out any other problem. There was
I
no.
asked about subarachnoid hemorrhage and stroke.
Okay, you asked about subarachnoid hemorrhage, standard club headache. He told you yes, it was one of the worst headache in my life. Okay, but again, it can come in different ways. Subarachnoid hemorrhage also can come with neck stiffness, photophobia, all of that, and it will get worse. So history wasn't very, detailed enough. Also, it will not take time to rule out all of this. Then you move to the management. You move to the management quite late, 7 minutes 30 seconds. And guess what? Did you give him any diagnosis here?
I was not quite sure about the diagnosis myself.
There was no diagnosis here. Okay, so you told him it is not migraine. Even you didn't explain to him why it is not migraine. You told him it is not migraine. Okay, so why it is not migraine? Because you don't have 1 to 3. So you didn't explain to him. So it wasn't patient centered. You told him it is not migraine, but you didn't convince him why it is not migraine. Then he told you about scan. You told him, yeah, scan could be one of the options. However, and then you asked him, do you have any medication for sex? Then you I don't know why you twisted the talking about the scan and asked him about medication during sex. So you told him come for face to face. We'll check your blood pressure, and then we can talk about further step when you come for face to face. You told him that. Then you told him if any more headache overnight, call 999. When you told him any questions, he told you should I avoid sex? You told him yes, try to avoid sex or any other triggers. He told you no triggers, it's just only sex because it is post-coital headache. It is post-coital headache. Okay, so you told him avoid sex until you come, and then we will find out, and then we'll discuss about medications. You didn't tell him even what are the medication options there. You didn't tell him about self-help measures as well. And actually, the management itself, he doesn't need face-to-face. He needs to go to A&E. he needs a scan. First presentation with post-coital headache, with severe headache, he needs to go to A&E because he needs a scan. And then if they ruled out any aneurysm or any tiny bleeding, yes, it is safe to manage him in the primary care, and there are many, many options that he can do. Self-help measures, again, here it will come as a share. Things that you can do by yourself, mainly self-help measures, things that we can offer you, medication for the acute episode, medication to prevent you from having any recurrent episode. We call it prophylactic. Then you can give him some safety advice and leave it. Okay, so history wasn't complete. There was no diagnosis. There was no any shared management options. Management wasn't correct. I know, guys, if you didn't read before post-coital headache flashcard, that's why I told you there is a case that could be tricky if you didn't read about it before. Post-coital headache, if you don't know that what you should do, how you manage it, I think you might lose it. You might lose it. Okay. Right. Muhammad, do you have anything to add before we quickly go through the flashcards?
Just a couple of quick things. So as Amr said, your IPS was really good in terms of interaction, smiling, changing your tone, and everything. Just one thing that you know, when patient told you, "Oh, I'm a bit embarrassed to talk about this," or I don't know from where I should start, doctor. Yeah, one of the things is just to make it a straight thing, nothing to be embarrassed about. But sometimes patient will say, "No, it's embarrassing for me." You cannot say nothing to be embarrassed about. So you can just reflect, listen to the patient, and then, oh, I appreciate being open. It's not always easy to talk about this, and just carry on with what you want to discuss with the patient. I felt like you are overusing seeking permission, and that was wasting your time and make you take more than 7 minutes in the data gathering. So it's one of the things that you can avoid, just to get a better understanding of your overall well-being. Do you smoke? How about alcohol? So at the end, the patient's rule here is to answer your questions, and your rule is to ask question. But if it's something sensitive, yeah, I would seek permission for, or even before I start all my question, I can just seek permission and just carry on. But not for every single thing. I would just, seek permission. Because, yeah, and at the end, you need to act as a doctor and to ask the patient question and a targeted question, just to focus on the problem. For as Amr mentioned about asking question about meningitis, other things, yeah, I feel that's really important. However, if you ask about a couple of red flags, and that's fine, and you don't have time, you can, and you get the diagnosis, you can move on rather than waiting, till 8 minutes before you move to the management. Because I know, yeah, you didn't spend much time on the management because you didn't know the diagnosis. But if for a case that you know the diagnosis, you need to give yourself a bit of time in the management. Especially that you have good IPS, you check the patient understanding, you check if the patient has any question or any concern in their mind. So that's one of the things. Other than this, your overall performance was really good.
Thank you.